Hi there and welcome to today's video which is on malaria. So, malaria is a disease caused by a parasite. So a parasite is spread to humans through bites of infected mosquitoes. People who have malaria usually feel very sick with a high fever and shaking chills. While the disease is uncommon in temperate climates, malaria is still common in tropical and subtropical countries. Each year, nearly 290 million people are infected with malaria and more than 400,000 people die of the disease. To reduce malaria infections, there are preventive drugs and insecticides treated bed nets to protect people from mosquito bites. So there is a malaria vaccine which is recommended for use in children who live in countries with high number of malaria cases. Protective bedding, clothes, nets and insecticides can protect you while travelling. You can also take preventative medicine before, during and after a trip to high risk areas. So many malaria parasites have developed resistance to common drugs used to treat the disease. So some people who have malaria experience cycles of malaria attacks. So an attack usually starts with shivering and chills, followed by a high fever, sweating, and a return to normal temperature. Malaria signs and symptoms typically begin with a few weeks after being bitten by an infected mosquito. However, sometimes a malaria parasite can lie dormant in your body for up to a year. And these are the symptoms you can see here generally: fever, chills, discomfort, headache, nausea, vomiting, diarrhea, abdominal pain, muscle joint pain, fatigue, rapid breathing, rapid heart rate, or cough. So the causes of malaria. So this is caused by a single parasite of the genus Plasmodium. So the parasite is transmitted to humans most commonly through mosquito bites. So this can be an uninfected mosquito. So a mosquito becomes infected by feeding on a person who has malaria. Transmission of parasites. So if this mosquito bites you in the future, it can transmit malarial parasites to you in the liver. Once the parasites enter your body, they travel to your liver, where some types can lie dormant for as long as a year. Into the bloodstream. Where the parasites mature, they leave the liver and affect your red blood cells. This is where people typically develop malaria symptoms. Onto the next person, if an uninfected mosquito bites you at this point in the cycle, it will become infected with malaria parasites and can spread them to other people it bites. There are also other modes of transmission. Because the parasites that cause malaria affect the red blood cells, people can catch malaria from exposure to infected blood, including from mother unborn child, for blood transfusions, through chaining needles used to inject drugs. There are risk factors, or these are visiting the areas where it's most common, and these include the subtropical and tropical regions of sub-Saharan Africa, South and Southeast Asia, Pacific Islands, Central America, and Northern South America. So how much risk you are depends on the local malaria control, seasonal changes in malaria rates, and the precautions you take to prevent mosquito bites. You're actually at risk for more severe disease if you are a young child, infant, older adult travelling from an area coming from an area with no malaria, pregnant women and unborn children. And in areas with high malaria rates, the problem is worsened by lack of access to preventative measures and medical care. So, interestingly, if you do live in an area where malaria is quite high, you can acquire partial immunity, which can lessen the severity of malaria symptoms. However, this partial immunity can disappear if you move to an area where you're no longer frequently exposed to a parasite. So you can have complications. So cerebral malaria. So if parasite-filled blood cells can block your small blood vessels to your brain. This is called cerebral malaria. Swelling of your brain or brain damage can occur. Cerebral malaria can cause seizures and coma. You can have breathing problems, so accumulated fluid in your lungs, pulmonary edema can make it difficult to breathe. You have organ failure, so malaria can damage the kidneys or liver or cause the spleen to rupture. Any of these conditions can be life-threatening. You have anemia, so malaria can result in not having enough blood cells for an adequate supply of oxygen to your blood tissues in a process known as anemia. You can have low blood sugar. Severe forms of malaria can cause low blood sugar in a process known as hypoglycemia. Aspirin, quinine, a common medication used to combat malaria. Very low blood sugar can result in coma or death. Malaria can recur. So some varieties of the malaria parasite, which typically cause milder forms of disease, can persist for years and cause relapses. So prevention, you can cover your skin, so wear pants and long sleeve shirts, tuck in your shirt and tuck pant legs into socks. Apply insect repellent to the skin, use an insect repellent registered with the environment agencies, which are known as DEET, Picaridin, IR535, oil of lemon eucalyptus, parabenthrin-free diol (PMD) or 2-undecanone. Don't use a spray directly on your face. Do not use products of oil, lemon, eucalyptus or PMD on children under the age of 3 years old. Apply repellent to your clothing, so sprays containing permethrin are safe to apply to your clothing. Sleep under a net. So bed net, particularly those treated with insecticides such as permethrin, help prevent mosquito bites while you are sleeping. For diagnosis, so blood tests can indicate the presence of the parasite in the blood to confirm you have malaria, which type of malaria parasite is causing your symptoms, if your infection is caused by a parasite resistant to certain drugs, and whether the disease is causing any serious complications. So for treatment, this will depend on the type of drugs, and length of treatment will vary. So it depends on which type of malarial parasite you have, the severity of your symptoms, your age, whether you're pregnant. The first one we'll look at is known as chloroquine phosphate. This is a preferred treatment for any parasite that is sensitive to the drug. In many parts of the world, parasites are resistant to chloroquine and the drug is no longer effective treatment. You have artemisinin-based combination therapies. This is a combination of 2 or more drugs that work against the malaria parasite in different ways. This is usually the preferred treatment for chloroquine-resistant malaria. Examples include artemether, lumefantrine, and artesunate mefloquine. Other common malarial drugs include atovaquone, proranol, quinine sulfate, and doxycycline, and vibramycin. You also have primaquine phosphate. So as I said, this all depends on what type of malaria parasite you're dealing with and the severity of your symptoms. Right, so that's the end of today's video. If you do have any questions, please do feel free to get in touch with your comment underneath, and thanks very much for listening. Thank you, bye bye.